And key areas that are impacting are aspects related to adolescent sexual reproductive health issues, maternal newborn health issues, and community programs. So you see, it's no longer about abortion anymore. It is directly getting into all aspects of health related to women, children, and young people.
Massive cuts in foreign assistance by the Trump administration and other donor governments have deeply affected health systems and women's health in the global south in the past year. How are governments in the global south and civil society organizations reacting to this, and what can we do about it? Rajat Khosla of the Partnership for Maternal, Newborn, and Child Health in Geneva explains. Hello, I'm Françoise Girard. Welcome to the Famous Podcast. Today, our guest is Rajat Khosla, the Executive Director of the Partnership for Maternal, Newborn, and Child Health based in Geneva, and he's talking to us from Geneva. Rajat has been focused on advancing health and human rights for his entire career, with a focus on sexual and reproductive health and rights, gender equality, and health equity. He's a passionate advocate for these issues, as well as a prolific writer who is widely published in scholarly and popular media. Rajat was previously director of the International Institute on Global Health at UN University, based in Malaysia. And before that, he was senior director for research, advocacy, and policy at Amnesty International in London and the human rights advisor with the World Health Organization in Geneva also. He's a graduate of the University of Delhi in India and the University of Essex in the UK. Rajat and I met many years ago now at the UN political negotiation on adolescent sexual and reproductive health and rights. And I have to say, I immediately realized that this man meant business and that he could move an agenda. So it's a real pleasure to have him today on the Famous Podcast. Welcome, Rajat.
Thank you, Françoise, and such a pleasure to be here with you today. And thank you for having me.
Yes, it's a real pleasure. Now, let's talk about what you're doing at PMNCH. It's a global partnership. I read of 1,500 plus or partner organizations across 6 constituencies, and all these groups collaborate to advance sexual reproductive health, maternal health, newborn, child, and adolescent health through effective policies, better financing, and improved service delivery. It includes 51 governments, of all the governments in the world, as well as several UN agencies, hundreds of civil society organizations, as well as private foundations and private sector companies. So it's a very diverse, broad group, which obviously is great because it gives you a unique overview of diverse concern and interests around the world. We'll talk a little bit later about PMNCH's current priorities, but first, can you tell me why you were interested in leading PMNCH, this huge hydra, if you want, especially at this time? You've been at the helm for 2 years, I guess, now. So now you have a better sense of what it all means. Why were you attracted by the idea of leading PMNCH?
Thanks for that, Françoise, and thank you again for having me here. I think part of it was the respect for the institution that it is, and the World Health Organization, an institution that I worked for almost a decade in the past, and the learnings that I had, but also working inside the organization, appreciating what it can do to deliver change, and as a hosted partnership. PMNCH has a unique vantage point and position, and I'll come to that in a moment. But equally important was the context in which we were, and this was 2024.
Yeah.
The big headline at that point in time was that the progress related to maternal child health issues, sexual and reproductive health, was plateauing and was reversing in many countries around the world. Post 2016, the trajectory of decline had somewhat stalled. And it was, the variety of reasons that we can talk about if time allows, was important to sit back and take account of. What was also happening with the stalling of progress and the reversal of gains that were happening, that there was a contestation of the agenda related to gender equality and sexual and reproductive health and rights that was starting to gain momentum.
Right.
You've been in these policy forums for far longer than myself, and it has always been an uphill battle for us when we went into for different aspects of SRHR agenda in global policy fora. But increasingly, what we were finding is that every singular reference to gender equality SRHR was getting contested in the global health policy conversations as
Mm-hmm.
well.
Mm-hmm.
Um, we were also seeing that there was an increase in initiatives championed by far right organizations, such as the Geneva Consensus Declaration, that was gaining momentum, and that there was a rapid decline in terms of the policy space. And for me, that was signaling a very deep disturbance on what was happening to the issues so famously enshrined in the Cairo Program of Action in the Beijing Declaration. And here is the partnership, a very unique entity in many ways. It is a hosted partnership of WHO, and as you in the introduction detail, it is a multi sectoral platform
Mm-hmm.
which includes governments, civil society organizations. We have the biggest consortia of civil society organization in the world today, with 750 organizations as part of that 1500 that you spoke about. So for me, the challenge was there, but the motivation was there as well, that here is a platform that, if delivered, can provide meaningful change for dialogue, for people to convene around. But for us to do that, we needed to be clear what was our value add in the ecosystem.
Right.
And that's the motivation with which I came in, and a singular promise that building movement and coalitions will be what we will deliver towards, so that even though the contestation is there, the progress is slowing, that we bring partners together towards a common purpose for the women, for the child, for the young person. And as you know, everything that happened in 25 just put a very different context to that entire characterization of the challenges that we confronted.
Right. And a lot more urgency, I suppose, given the
Precisely.
reversals that we're facing. I mean, let's talk about the Trump administration in the US. The Trump administration came in very quickly, enacting deep
Mm.
cuts in foreign assistance, through Elon Musk's Doge. Dismantle USAID, which was the organ in the U.S. government that provided foreign assistance by and large. There was some also in other ministries, but this was the main one. And of course, very harmful executive orders that the administration adopted, like on day one, on issues of gender, on issues of abortion, on issues of diversity, equity, and inclusion. And all this, of course, affects what the US government is prepared to fund through its foreign assistance. So that's been, in addition to the general context we're dealing with, very, very problematic. What are you hearing? Since you have these deep partners on the ground, what are your partners telling you about the situation on the ground? How bad is it as a result of all of this?
Very bad.
Yeah.
Very bad. And I think the word that you use there is extremely important to reflect upon, is quickly. How quickly all of this has happened. We are only in 18 months of the present administration, but there are a few things that have happened, and some of what you just talked about. But it is important to look at them in their totality.
Hmm.
First is what you just said, the institution of executive orders, the reinstatement of the global gag rule, the Mexico City policy, and the dismantling of the aid architecture. Um, part of which is, the dismantling of ODA, part of which is indeed due to what happened from the Trump administration, but also in terms of what has happened or followed through, the other countries in Western Europe, the traditional ODA supporters as well. And that has had deep and profound impact in terms of countries' ability to continue with the programming related to sexual and reproductive health and rights. But the story doesn't end there. And this is where a totality of picture is important. The second thing that has happened is the institution of what is called as the America First Global Health Strategy,
Right.
which has come into effect, as you know, through government to government bilateral contracts that are being instituted with a number of countries. At the last count, there are about 36 of them being negotiated. And the importance of these is critical to examine. What it is doing is making health a bilateral relationship discussions, and there are issues in terms of how we are looking at aspects related to not just particular priorities within those agreements, but also compliance requirements in those agreements, whether there are data compliance requirements or whether there are compliance in terms of legislations related to US government policies. So the aspects related to Mexico City policy and its implementation is no longer only part of an executive order. It is now part of a bilateral contract, sovereign treaties
Wow.
that are being discussed. So it is no longer, something that a future administration can reverse
Mm.
as one expects.
Right.
The third thing that has happened, and this is the expansion of the global gag rule that happened earlier this year. As you know, with the expansion, what has happened that it is no longer about the family planning related funding, it is about all non-military funding that is being impacted. So the scope has expanded dramatically from about $700 million to $30 billion.
And this is all to prevent any work on our advocacy on abortion. Uh,
Not just that anymore.
no.
Previously, it was only to regulate that particular aspect that is of abortion, but now it is implicating all work related to gender ideology as it has been defined. So, gender equity analysis is being impacted. Health equity analyses cannot be undertaken. So, the scope has become much wider, much harsher. And then the other part of it is also related to whom it is being applied to. So the whom now is not only US based organizations, it also includes governments, it also includes multilaterals, it also includes INGOs. So you imagine the scope has suddenly. So when you do look at it from a country level up perspective, your question to me, the impact is quite dramatic because, the dismantling of aid, the availability of resources has suddenly diminished substantially.
Hmm.
And while we all want to see the change happen in terms of domestic financing of these issues, it is going to take time for it to deliver. But what it has also done is setting in what can only be described as a chilling effect. Many, for the sake of preserving the resources, preserving their ability to continue, are now deprioritizing a certain set of issues, and that is becoming hugely problematic. Some are stopping work altogether because they just cannot continue because there is no resources.
Hmm.
And this is also coming because there is shrinking civic space, and civil society organizations which were already working in a very restrictive environments in many spaces are just not able to function. So towards the end of last year, we did a SNAP survey with respondents from over 20 countries that reported back about 19% reported they were shutting down operations already. This is October last year.
Wow.
And about 60% that reported saying that they are scaling down work related to sexual reproductive health substantially that they were doing. And key areas that are impacting are aspects related to adolescent sexual reproductive health issues, maternal newborn health issues, and community programs. So you see, it's no longer about abortion anymore.
No.
It is directly getting into all aspects of health related to women, children, and young people.
Right. And the part that we haven't, I think, seen unfold yet fully, or we're still not fully grasping, is what uh, preventing work on gender uh, and diversity, you alluded to some of it, diversity and equity is going to mean in reality. How far are they
Precisely.
going to take this? If you can't do work on gender equality, because gender is the word gender appears, that means we can't do work on women's rights anymore? Is that what we're talking about? Like, if the US government gives you any foreign assistance under this new America First strategy, you have to shut down all the work you were doing as a government or an NGO or, a community based organization to advance women's rights, potentially. I mean, they could take this very, very far.
Potentially, indeed, and or restricted to the areas that align with their policy priorities as such. And I think it is going to have direct impact, especially in the reproductive health space, on some of the issues
Yeah,
that we are finding very difficult for countries to look at contraception and contraceptive access being one of them.
that's really. What are some of the most unexpected repercussions of these US policies? Are there some things we haven't uh, imagined that are happening that I'm particularly concerned about all that the work on women's rights. I mean, what else are you seeing that was like, wow, we didn't see that coming?
So I think the challenge that we have is that because a lot of it is still so unclear
Hmm.
and so vague, it is hard to navigate precisely where the impact is going to be and how. And also a lot of these discussions, these bilateral compacts, there's very little information. There are only four that have been published of the
Wow.
30 plus that I talked about. So there is a level of ambiguity, vagueness that we are, and that is challenging, as you would imagine.
And so the
Um,
US has not published these agreements. No.
no,
Mm.
and given the civil society is not involved at the country level, there is no way to get that kind of the transparency and the data that
Mhm.
one would so require. Um, I think there are aspects, some of what you were just starting to talk about, the impact on understanding inequities, equity analyses, and not just in terms of gender and related inequities, but across the stratification that is so core to our work to build health policies and strategies that are responsive is very clear. The other is, I think, the impact where all it is going to have is still not clear. And given this expansion of the scope, one of the things that I think is becoming increased, whether this will have, for instance, impact on how the procurement supply management systems work in terms of procurement of commodities, etc., how that is going to happen. Because you also have to put it in place that this is all happening in the larger context of the entire shifts that are happening in global health and global UN80 reforms and other things that are
Mhm.
taking place. The other is the impact it might have on humanitarian relief and operations as well, something which has traditionally, as you know, have always been explicitly excluded. That's not clear yet whether it will be coming with waivers, and if it does not come with waivers, how will it impact the ability of humanitarian organizations
Yeah.
to operate with principles of neutrality, of impartiality, and deliver on their mandate? So there is a lot of unknown, which, as one would imagine, can settle in, deep anxieties on
Yeah.
how this will shape up.
I mean, when you're talking about supply chain of commodities, for example, how contraceptives are moved into a health system, let's say in Malawi or in, Namibia, that could be in the mix now because everything is now up for grabs with these new strategies and these new bilateral agreements. And if anything is perceived to be, offensive to the US far right, which is now in power, uh, a lot of it could be very vulnerable. Yeah, yeah, yeah.
Indeed, and and I think within a context where the capacities of countries are very limited to
Mm-hmm.
backstop
Mm-hmm.
those things, and we're not just only talking about low income countries here. The kind of challenges that it is throwing in for middle income countries is going to be
Also, yeah,
severe.
yeah, yeah. So, how is the partnership reacting to all of this? Have you been able to, let's say, persuade donor governments, private foundations, others to come in with more funding, to come in with, an alternative vision for sexual and reproductive health and rights, maternal health, and so on?
It's a there is a lot of hope in this chaos to draw upon.
Mm.
Countries are taking ownership. Countries are doing a lot that they think needs to be prioritized, and I'm seeing across a spectrum of issues that there is a lot of movement that is starting to happen. I take huge strength, for instance, for initiatives at the continental level in Africa, not just prioritizing issues around reproductive maternal child health as a ongoing priority at the summit level at Africa Union, and putting resources towards it, but also going deep on conversations related to domestic resource mobilization and financing related to that. Now,
Mhm.
it's not easy. It
No.
is challenging.
Yeah.
It is, but the fact that there is a conversation that is happening gives a huge aspect for all of us to be positive about.
Hmm.
I think there are extremely rich discussions, for instance, that I have been part of, where the conversations are looking at aspects related to debt and debt cancellation. As you know, for many countries, the fiscal space is severely constrained because of debt servicing that needs to happen. So conversations are starting to shape in terms of what can we do, and can we look at debt swaps, debt cancellation processes to take place.
Mm-hmm.
Some remarkable conversations are happening, and initiatives that are starting to develop in terms of innovative financing model, looking at taxation syntaxes like taxes on alcohol, tobacco, food, to service health agendas. Slow moving. And I think this is where our role as partners working together becomes important, bringing in best practices, bringing in technical expertise that can help, work on these efforts
Mm.
with the leadership of countries that are championing these issues. And we are seeing, although it is a reduced spectrum of donor governments now within the space that we are talking about, but we do see laudable efforts being done by some of the countries to say sexual reproductive health and rights will remain their key priorities, even though their ODAs have reduced, but they are putting in. And there are, great examples from countries like Norway, Sweden, who are doing exactly that. Spain just concluded the feminist foreign policy ministerial meeting and recognizing SRHR as a key component of feminist foreign policy.
Hmm.
So, there is all of that is happening.
Yeah.
But yes, the scale of challenge is indeed rather large at the moment.
Yeah, and in general, as you said, overseas development assistance (ODA) has diminished, not just from the U.S. but from other governments in Europe and elsewhere. So it is a double whammy, right? I mean, this is a very difficult moment for a lot of
Well, and,
countries
and
in the global south.
and the numbers are huge, right?
Right.
23% in 2025 only, the decline in ODA.
In 1 year.
23% in 1 year. And there is a further 5.6% decline anticipated for this year.
Yeah.
These are very big numbers,
Yeah.
and as you know, what remains of ODA is not necessarily going to the issues that we are talking about. It is going towards servicing domestic agendas related to aspects related to migration and refugee resettlement. So I think this is where the disproportionate burden that is falling in terms of issues related to sexual reproductive health and women's health and rights more broadly is rather startling.
Right. Right. So that's the a real challenge for the partnership to tackle that head on, right? I mean, that's right in front of you.
Oh,
Mm.
if I was blunt, I would say the real challenge for the partnership and probably for all of us in the ecosystem today is the deprioritization of the agenda that is happening. Not many are coming up and saying, "This is my first priority, and this is where we will be going,
Mm.
full throttle on." And this is where I feel particularly challenged, as the global architecture reforms and resettles itself as aid resettles itself, that our issues are being left behind
Right.
and constantly being deprioritized.
Some countries in the global south, I mean, like India, for example, have some capacity. Have they expressed desire to increase their domestic investment in these issues of sexual and reproductive health and rights? I mean, this is an opportunity for them to assert their sovereignty, which is another word that's buzzword that's bandied about a lot at the global level right now.
You see, India did a smart thing about a decade ago
Mm.
was move away from ODA and make funding for health as their domestic priority. So if you look
Ah,
at the fiscal expenditure today and the recent data that came out, m- m- uh, India is self-financing healthcare
ah,
across the spectrum of issues,
okay.
and with the size of economy we are talking about, the overseas contributions are negligible today. But I think there are lot more countries need to follow that suit. I think
Hmm.
lot more countries, and especially countries which are middle and upper middle income countries, need to do that and to come into that space. Because there is the other thing that India is doing, which goes back to one of your previous question, is that India is also a rather catalytic player when it comes to strengthening regional manufacturing capacity.
Right.
And if we are going to be looking at a model in which countries are financing these agendas themselves, the countries will have to resource these commodities and these diagnostics and supplies themselves as well. And therefore, India as a hub for regional manufacturing across a spectrum of health diagnostic and products becomes
Yeah.
extremely important.
Important. They play that role as a drug manufacturer and device manufacturer that can be an engine for the region, right? And the world
Absolutely.
and
And the
the
same
world,
goes
frankly.
for and the world, and the same goes for South Africa, and the same goes for countries like Malaysia,
Brazil,
etc. So I
yeah.
think there is Brazil indeed. So I think that this is where I think we need to look at multilateralism in all its complexities today. I think we are into a space, Francois, that we must look at uh, the global landscape with a more multipolarity
Mm.
of perspective. Regional alliances, sub-regional mechanisms are likely to deliver much more strongly right now, and they are, as the example I just gave you of AU, the work that is happening at SADC, what we did with the G20 in South Africa last year, remarkable progress in these contested times as well.
Right. Now, I saw that the partnership was joining, or I don't know if you're coordinating or hosting or what, the new Global South Coalition for Sexual and Reproductive Health and Rights and Development Justice, which is a coalition of Global South civil society organizations reinvesting the international space, the multilateral space, to push for sexual and reproductive health and rights and development justice, the right to development together. And I interviewed our dear friend Geeta Sen about this a couple of months ago. Why is that Global South Coalition so important for PMNCH? What are your why are you so interested in this initiative?
Well, that's the way to go. And
Ah,
as I said, for me, the big proposition is today is building alliances, strengthening coalitions, and the reason that we are part of it and we're part of the core group of the Global South Coalition, and very proudly so,
mm,
is because it is one such initiative that shows the value and importance of not just building a coalition, but building an intersectional coalition, that we bring our agendas together under a common purpose to deliver on these issues. For the longest, as you know, and our biggest challenge has been is the sexual reproductive health and rights agenda has been largely seen as a global north agenda, and
right.
that this is something, as we have sat through in policy circles, been one of the big challenges that has been often thrown to us. What the Global South Coalition is doing is leveraging the leadership of Global South for these issues, but also bringing in alongside issues that we have not yet had as centrally as part of whether they are global policy dialogues or other ones in terms of development justice.
Hmm.
And linking sexual and reproductive health and rights issues with development justice brings a contextual reality that today is far more important for us to accept and work with to advance these issues together, because no country can advance the women's health agenda, the sexual and reproductive rights agenda, or the young people's agenda without strengthening the disparities in power, the disconnects in development that we are seeing today. So I think there is a much value and kudos to leaders like Geeta, for bringing us all together under this umbrella.
Right. And I mean, there has been in these negotiations, as you say, a disconnect, right, between people arguing for access, let's say, to contraceptive, abortion care, access to adolescent health services, and then those concerned with issues of trade, debt, economic equity, climate justice. All these things have not come together. And yet, as you explained, how are you going to invest in your population and your health system when you don't have the economic wherewithal, right? Because of the health and the economic inequities, the global health inequities. So it's time. I agree with you, and I really agreed with Geeta that it's time to bring this back together, because you can't keep blaming countries from the global south for not investing in their health systems when you actually prevent them from actually developing their economy and their trade and their industry and their manufacturing and so on through all these the tricks of the trade that the global north is very good at to keep countries in the global south dependent and hamstrung.
Well, 100%, and then I think it challenges us not just to rethink the narrative that we need to, but it challenges us to address the deep imbalances of power
Hmm.
that the spaces and these conversations are often riddled with, and address those imbalances of power and address the extractiveness of the nature of conversation that it often happens. You've sat through far more negotiations than I have, but I think there is a value in that, that I think we are seeing a lot more excitement when we are able to have a more coherent narrative
Hmm.
on these issues.
Hmm. Hmm. Now tell me, you just came out not too long ago from out of the World Health Assembly, where some of these conversations were very much related to this whole debate. There's this annex to the pandemic treaty on sharing of pathogens, which is the idea that when there's a new virus, we need to have collaboration to share the knowledge and develop vaccines and distribute vaccines, something that didn't happen during COVID and was really, I mean, incredibly harmful and dangerous. And so, how how did you experience the World Health Assembly, in that sense of with questions of health equity and justice and development justice?
It's remarkable that even after an event that took 2 million lives,
Yeah,
that we still are not able to find consensus on these issues. It is
right.
incredible. And as WHO Director General Dr. Tedros have rightly said, we really cannot go back to those things, and we have to learn our lessons, and we have to address those challenges. He has written an open letter ahead of the upcoming G7 summit with president of Brazil, President Lula, and I think he makes that precise point that there are three things that one needs to reflect on: the need for the highest level of political will for us to be able to do this, and do this now. This
Mm.
cannot wait. And as the events of the last couple of months have shown,
Yeah.
we have we are witnessing the epidemics like Ebola, and the resurgence, and the challenges that it is presenting. The second is the issue of health equity, and you touched upon it, Francoise. And I think health equity and inequities that we are talking about just cannot be ignored. And I really recommend reading that letter
Mm.
that, in my view, comes straight from the heart. And then we need to work with a sense of urgency. And as this recent incident of Ebola has shown, that it has come from a part of the country which is conflict affected, that we cannot reach and we cannot address it in a timely manner. And we need to address these issues. We need to get over, the difficulties in negotiation, and come and address this final hurdle of the annex on the pathogen access and benefit sharing.
Mhm.
And I know it can be done. Countries have come together and made these leaps of faith, but I think the timing is now, because also I think the other big conversation that happened at the World Health Assembly is the conversation that is taking place with regards to the review and reform of global health architecture.
Mhm.
That, are we in, not just because of the fiscal constraints that we are confronted with, but in the time that we are in 2026, and as we look at the future, do we have the systems, do we have the institutions, do we have the processes ready for us to be able to do that? There is work that is going on, there is some very good thinking that is coming out. We need to engage in these processes because a lot is happening, and a lot is happening very quickly. There are technological revolutions that are happening, that are changing the way we look at these things.
Yeah.
There are processes that are underway, that are redefining, whether it was shifts in the way health is being financed. So I do think there is a great opportunity here for us to look at these things in totality, but we must address these disconnects in our global policy thinking.
Yes, that's right. And ensure that women's health, children's health, and adolescent health remains a priority, because it's so easy for some of these decision makers to just shove it by the wayside. Yeah, that's right. That's why we
Indeed.
need you. We need the partnership. Thank you, Rajat, for your insights and for some glimmers of hope. I was pleased to hear that you feel there's some opportunities in this time of change, that maybe this is the way in which we get countries to take more responsibility for this, where we challenge some of the existing structures that are no longer fit for purpose. So let's continue to struggle together. A luta
Thank you.
continua.
Thanks, Françoise. Thank you.
Thank you, Rajat, and good luck.
Expiro, expiro.